Hello, everybody, and welcome to Bright Founders Talk at Temi. Temi is an international software development company that designs, builds, and delivers software for sustainable businesses and promising startups. Welcome to our podcast, where we bring you the most inspiring stories of entrepreneurs and experts in the software development industry. And each week, we interview successful leaders who share their unique journeys and valuable insights. I'm your host, Barry, and today we're lucky enough to be joined by a remarkable guest, Duncan Weatherston, who is CEO at Smile Digital Health. Hello, Duncan. Welcome to the podcast.
Hi, thanks for having me.
It's our pleasure. Firstly, thank you so much for taking time out of your day. We know you're a busy man, so we do appreciate you using that time to speak with us. But for anyone who doesn't know who you are, could you tell us a little bit about yourself and the company that you work at?
Yeah, sure. I'm Duncan Weatherston. I'm one of the founders and the CEO of Smile Digital Health. Smile is a healthcare software platform that is used globally. Our focus is what we call semantic and structural interoperability, which is the ability for you to use information in a way that is consistent regardless of its source. So, as an example, if you think about a laboratory, it might have concentration in it. There's lots of ways of recording concentration. Semantic interoperability is, picking a specific way of interpreting concentration and using that every time you interact with it. And the reason why you do this is it gives you a chance to make information computable in a way that allows you to do things like charting, trending, tracking. It lets you do all of the things that would allow you to evaluate health information in a meaningful way for the delivery of care. And so we've built a platform that does that. And then over top of that, we've built a platform that is enabling clinicians and payers to then do the evaluation prescribing. We have an entire clinical reasoning and logic layer that sits on top. And it's pretty transformative. We're going to talk a bit more about it as we get through the podcast, I assume.
Sure, sounds interesting. Just before that, did you know that you were going to be an entrepreneur? Was it in your blood that you wanted to be a co-founder or a CEO?
Well, I guess so. I was 18 when I started my first business, and I've been an employee of somebody else for about 4 years in my life. So yeah, I guess it's kind of endemic.
And did you build a big network prior to starting the company, or was it something that you developed after starting the company?
In my case, I started a company in an industry I'd been an independent consultant in for a few years. I'd had a business, and then I had sort of wound it down and gone into consulting, and then started a few businesses that didn't really go anywhere I wanted. And then when I started this one, I already had both a network and experience. So story of don't if you first you don't succeed, keep trying.
That's very true. So what actually motivated you to start this company? What was the driving factor?
Well, I mean, I'd love to have I have a very good reason for why I chose to do this particular business, but starting a company, I enjoy building things. I enjoy the opportunity to have an impact on the environment around me, and I enjoy trying to make things better. Right. One of the guiding principles I have in my life is, I feel like I want the world to be a better place because I was here. And as an individual, I found I could deliver quite a lot of value, but I feel that as the head of a company, I can deliver more value. So that was my motivating factor. Healthcare, in context what I'm describing, is an obvious place to go because healthcare gives you a big opportunity to have a large impact to make people's lives better. So it's a good place to be working.
What are some of the flagship products or technologies that Smile Digital Health offers?
So the data platform is the baseline for what we do, right? So when we started the business, one of the challenges we faced was that the way that other software for healthcare scaled was limited by the fact that the target audience for software is typically hospitals or clinics, and those are relatively small compared to the environment we were operating in. The environment I was operating in is in Canada. It was at scale for Ontario, which is roughly 15 million people, a few hundred hospitals, tens of thousands of doctors, and every time we bought software for that ecosystem, it didn't scale effectively. We ended up writing our own layer in front of it quite frequently. And having done that a few times, we decided that we would write our own platform because we'd done it a few times and then make that commercially available. it was that drove our initial piece of business. And, having worked, the information we were gathering at the time was the labs, drugs, diagnostic imaging, acute care data, primary care data, long-term mental health data, long-term care and mental health data. So it was, you can picture, a fairly broad array of the kind of information that's used in healthcare. And the reason we were gathering it was A, so that clinicians could use it in day-to-day practice, and B, so that we could provide system advantage. And so my expectation was that if I did a job building a platform that was able to, make this data ubiquitously available in a meaningful way, and like I said earlier on, with semantic and structural interoperability, other people would build the next layer on top of that, which is the ability to do computation. We've been in business for coming up on 9 years. And in that time, we have yet to see anybody take real advantage of the structured information the way we expected. And so as a consequence, we built a system that does that as well. I mean, I acquired or slash merged with a company that had a very, very advanced platform in that space, and we're moving it forward in a productized way today. So what we've got now is this really cool ability to take a policy that exists in language, convert it very rapidly to computable code, and then make that available for the policy owner or user to operate their business or operate their clinical need or inform their patients, or whatever it happens to be. And the transformation here is that we're using AI to enable the rapid integration of these policies into a predictable and usable outcome. And the part that's most critical to that comment is the way we build everything allows us to have a deterministic outcome,
Mhm.
despite the fact that we're using an AI model to build out our capability.
How does your platform actually improve like patient engagement and outcomes, for example, compared to other traditional healthcare methods?
So the key here is back to what I was saying about structured and semantically interoperable information. Imagine you've got, I mean, for healthcare, the challenge here is that A, information is incredibly complicated. The use cases for it are diverse. The engagement with it is dependent on an existing knowledge base or education set. And then the accessibility to that information is driven by a set of often competing and at least diverse businesses, right? So the ecosystem which you're trying to deal with health information is both heterogeneous and hostile, for lack of a better term for the average person, right? The terminology, the structure, the content, the interpretation, and when I say hostile, it's not just hostile in the sense that it's hard to understand, but fraught with emotional impact, right? Discovering you have cancer, or, the diseases that you could potentially interact with are significantly emotional to the individuals who get it. So into that ecosystem, into that environment, providing a mechanism by which information is accessible, understandable, consistent, reusable, interpretable is really a big win. And then over top of that, being able to provide a layer that gives interpretation that is relevant to the viewer is a layer of additional value that makes a big difference. And for example, if you can imagine the character of let's imagine a heart condition, right? Something which is maybe a chronic disease that you've acquired after a period of time that has a substantial risk to well-being. You could a stroke is a life-changing event. Heart attack is a life-changing event. So you've got a heart condition and you have to manage it. As a clinician, it's episodic, right? The patient interacts with you, you provide them with some advice or maybe a physical intervention, they recover and they go on their way, and then they show up again, as is necessary based on their symptoms. From a patient's experience, it is an ongoing interaction and a day-to-day interaction with it. They have, as they go, they become increasingly aware of the characteristics of their disease, to the point where after a few years, they're already experts at a level that a clinician is as well, in their specific disease, in their case.
Mm.
To the family of the patient, it's more episodic, but it's still continuous, right? They have to, your wife or your husband or your daughter or whatever has to deal with you on a day-to-day basis, and so they interact with you in the care and support characteristic. So everybody that you encounter has a different view of that, and if you can't structure and present it for that, there's somebody who's getting a disservice, right? So that's how information delivers value. And then if you think about objective, the objective would be to make that information meaningfully usable by all the participants. And back to the idea, right? So when you're a clinician and you have an episodic encounter, what you want to know is the history of the patient. You want to know what the probability of additional risk is. You want to be able to have adherence data about the patient's interaction with the medications you prescribed. You want to understand what the care team is seeing because the patient may have comorbidities and maybe other reasons they're encountering clinicians above and beyond your cardiac situation. And so from the clinical experience, you want to have cognitive support, you want to have structural support, you want to have continuity, and you want to be able to do that quickly because you have a lot of patients to see and it's a resource challenged ecosystem. Right. So the clinician engagement is all about having sufficient information, sufficient advice, and sufficient breadth of perspective to be able to treat the patient at the maximum level of efficiency and capability, and then get them on their way.
You
When a
mentioned
patient interacts with that information, they want to be able to, on a daily basis, know, are they making themselves healthier or not? Are they at risk or not? What is the next encounter they have to maintain their quality of care? And so one of the things that we believe is that patients should have access to all of the care gap information, all the things they're not doing, as well as the things they are doing. They should be able to interact with the health system in a way that gives them the advice they need to be able to interoperate, to be able to operate as an effective patient, right? And then
yeah.
family needs to be able to see how their patient is doing, how how their father is doing, how their mother is doing, whatever happens to be, in a way that enables them to provide the ongoing support without being, intrusive, perhaps, or without being insufficiently intrusive to be able to operate. Right? So you could picture, in an ideal world, as a patient, you'd get up in the morning, you'd watch would tell you what was necessary for immediate interaction. You'd be able to go and take a look at an application and see what your next best action is, what you should be doing. You should be able to evaluate that in the context of a care pathway that you've been prescribed by a clinician. So you go through your day and you start to be able to see whether or not you're within the range you should be in. If you're not, you should be able to reach out to a clinician and say, I appear to be in some, I'm off the path for some reason. And then a clinician should be able to evaluate, you should come in, you shouldn't come in, you're okay. And then your care team, regardless of who they are, family, other clinicians, should be able to participate in that decision and then know what their role is. And that's the vision we have, right? That's what we're
Mm.
trying to deliver. And if you imagine what that means in developed nations, that means getting care in a way that is continuous and consistent. In developing nations, it's got a completely different implication. And we're a global company. We have clients in 20 countries and more. So our vision is for delivering care globally. And if you imagine what that means for a person who's living in a country, for example, where you can go buy whatever drug you want, right? I mean, a clinician may prescribe something, but you read it online and you discover you need a drug or whatever it happens to be that is your source of information. You can imagine there's a very substantial risk of care, right? There's a risk to the quality of care you're going to get. In those ecosystems, we can actually roll out meaningful care on the back of information. And when you say, well, how are they going to get the data? It's reasonable in almost every country to train nurses, right? There are, a number of people who are willing to help each other. The hard piece is to train clinicians because it's a multi-year process. Both pathways are multi-year, but you can train rudimentary nursing, the ability to go and gather information, to be able to do palpitation, those types of things, in a couple of years, and then obviously their lifetime of experience moves nurses into that next category of care provider. But you can train them, right? That's my point in a more rapid way in developing nations. And so now what I can do is you could imagine an ecosystem where we have nurses gathering information in the community. We have family members participating. And what we're using is phones as devices. And modern phones are incredibly powerful computing platforms, at least for the purpose of gathering information and interaction. We can use that information, aggregate it in the appropriate store, and then make that available clinically to both intelligence and structured use of information, and then, as necessary, clinicians who can be more interventional against a broader population. So we're able to reasonably offer a hope of improved care globally on the back of this strategy. And when I say we, I mean we, the community, not Smile. I want to participate in that to the extent that I can.
It's really interesting. So, in terms of the international environment, do you find it kind of difficult or complex to have multiple different requirements from different countries, or do you manage that quite seamlessly?
Yes, it's interesting. When you think about healthcare, the things that drive it are complex, right? So on one front, there's social determinants of health. If you've got access to food, if you've got access to water, if you've got access to a clean living environment. On the other front is your biology, which is consistent. We've got similar hearts and we've got similar eyes and we've got similar lungs. And so that characteristic is actually, a thing that is applicable through the technology space. So where you have to worry about local variation is mostly in legislation, what's allowed and not allowed, availability of resources and access to care. And then lastly, the community ethic and community morals, right? So what's normal and not normal, acceptable and not acceptable. And you can see the distinction when you talk internationally. There are environments where people giving immunizations are at risk. And there are environments where it's welcomed as a for example, right? And so that kind of is permeates throughout how the healthcare ecosystem.
So in terms of like patient data, it's highly sensitive. How does Smile Digital Health ensure like the data security and compliance with regulations like GDPR, for example?
Yeah. So there's a couple of answers to that question. One, we're a software platform, and so we write our software secure. My part of my background, I was a security architect in those years where I was an independent consultant doing my thing. So, and I've been in healthcare for now 25 years. So
Hmm.
we are acutely aware of the importance of privacy and security to healthcare. And we built our platform with that from the ground up. So, there's a thing called defense in depth and zero trust. So on one side, which is anything you deploy, you have to assume that every layer is potentially compromised. You can't trust any particular layer of your security. So the thing facing the network provides a layer of security, but it also could be compromised and become untrustworthy. The network infrastructure provides a layer of security, but it could become compromised and become untrustworthy. The servers themselves, etc., right, all the way down. So our platform uses that on one level, and then where we're operating on people's behalf, because we sell the software and people manage it themselves, or in some cases we manage software. Where we manage software, we go well beyond just the infrastructure security. We have a set of operations and practices which ensure that not just the people interacting with our systems, but the staff using the systems have guidelines and controls in place to ensure that they don't misuse information. It is one of the most important things in healthcare. I mean, it's weird. Healthcare is weird about this, right? People say what you just said is, it's super important to have security in healthcare. And it is because we're a private species. We don't like disclosing our information publicly. On the flip side, we act as if your common cold has the same degree of sensitivity as the STI that you might have had when you were in college. And that's absurd because when you walk to work and you're sniffling and sneezing, everybody can see you're sick, right? Or if you've got a broken leg, everybody can see you have a broken leg. And in fact, if you have a cancer diagnosis, the first thing you want is everybody who can treat you to see your data. So if you think about the weird conflict we have in healthcare, this is absolutely private, secret information, but share it with everybody who needs to know. And we can't tell who needs to know ahead of time. So share it with everybody, but keep it secret. So you have to be really aware of that dichotomy when you're trying to deliver healthcare security, because if you were to lock it down too much, you're going to do the patient a disservice because they want people to treat them. And if you act in a way that is aligned with the most accessible and open group of people who want to share their information, there are people who have very sensitive reasons to not want to share their data, and the risk to them is quite high. So you have to be sensitive to the nuances of situation. You have to create the capability to constrain information while making it very easy to share and access. Security for healthcare is a complex topic, and it's one that you have to handle with awareness and engagement, or you'll get it wrong in both directions. And so Smile was driven to make sure that we sit right at the sweet spot. You can't break into our systems, but if you want to have access to it, you've got full control over who you give access to.
That's so interesting. And I remember you saying earlier about AI at the start of this interview. Could you just tell us a little bit about that in terms of how you're currently using AI and potentially what you want it to do in the near future?
So AI is a fundamental technology that going forward will be as transformative as, you know, accessible coding, right? When my dad was a computer guy in the 50s, and when he started coding, he had dip switches on the backs of computers, right? That was a mystic art where you had to be able to keep everything in your head, be able to track the machine state and then debug it, not by running repeatedly, but by having a logical model and being able to discern when something doesn't work, where in that logical model is broken. That is not an accessible development platform, and if you're trying to roll that out globally, you would have a very limited access to software. We went through a process. We had various generations of languages up to 4GL, languages that are human interactive. Those enabled us to have a complete transformation in accessibility and reliability of computing. AI is another layer on top of that. It's a mechanism by which we're able to interact with systems to achieve outcomes that are meaningful. So Smile fully buys into that value prop. There is a lot of hype about AI, right? This notion that, we're going towards the singularity, and that we're going to have a replacement for general intelligence. And it is entirely feasible that could happen someday. That is highly improbable to occur in the short term in a meaningful way for the average implementation. So Smile buys into the idea of AI, and we use it very, very consistently, but we don't have a starry-eyed view of it that says, it's going to come along and I won't have to do anything. It's just going to go and magically give healthcare to everybody. So with that in mind, what we do is we use AI in a fashion that is optimizing its capabilities, the ability to interpret ambiguous content, the ability to read language and then generate code, the ability to provide a facility for humans to interact with complex ideas, restructure the information, present it back in meaningful ways, the ability to provide analytic services to the extent that errors are okay and expertise is a sufficient level of defensibility of the content that you get, right? So where you need to have a guaranteed output. Here's the way I think about it, and it's a kind of inane way of putting it, but humans need calculators, AIs need calculators, right? We're spectacular intelligences. You and I could sit down, spend a few years studying, and be able to solve puzzles that are intractable to most levels of computation without very specialized coding. And then, at the same time, we can flip hamburgers and also have a conversation about the quality of water, right? That flexibility and generalization with deep specialization is currently unique to humans, right? And so we still, despite all of that capability, have a hard time remembering 48 numbers and then doing simple calculations like multiplying, adding, and dividing them in a stream, right? Whereas a computer does that mechanistically very, very easily, right? And so AIs have that same characteristic as us. They're written in ways that hold a bunch of ambiguous information, and as a consequence, they have an ability to integrate and interpret. I mean, I'm using those words loosely because interpretation
Mm.
from humans to computers is different, but they have the ability to stack up conceptual models and then apply a pathway through that conceptual model to have an outcome very effectively. But it leads to the same problem that humans do. They make mistakes, right? And so if you want to have an AI that's going to deliver a predictable outcome, the same way I would expect you to use a calculator if I asked you a set of complex math problems, you expect an AI to do it. And what we've done as humans is we've created these mechanistic solutions that are deterministic in nature using computing because it's a better way for us to get an outcome than to try and use our incredibly good brains and run the risk of mistake. We see the same thing ourselves in the use of AI for healthcare. We think that you can build models that are very good at getting you interpretive interaction, but are vastly improved by having predictive outcomes where necessary, calculating all of the features. So we know that in healthcare, we use science to build care pathways that are deterministic. If you have this condition and that condition, and your blood sugar is above this number, and a set of characteristics, we can do a calculation that says you have these next actions that are necessary, right? And I'm not going to even roll it up in diseases because, in fact, everybody's a collection of symptoms and then therapies that treat those symptoms. And there's, we're basically, to be inelegant, we're basically a chemical sack that has a set of chemical pathways that are treatable and reparable by additional chemical interaction that leads to a consistent chemical operation. Like to be pedantic about it, we really are a physical process with I mean, this lovely cognitive thing that sits up top over it. I'm not going to try and guess at the character of that, but in terms of ongoing operations of that brain, we do have a set of measurable, scientific, evaluable outcomes. And so computing in that space is fantastic. We know that drugs treat this issue. We take all these symptoms, we pile them up into a disease, makes it nice and easy for someone to understand, right? We say, you have a heart condition. What actually a heart condition is a set of characteristics about a muscle that operates at the center of your chest that delivers blood on an ongoing basis, right? So we wrap them up into nice words so that we can treat them and we can apply an effective process to them. But the real core piece is you have a pathophysiology that has a set of expressions that we know how to measure, and then we have a set of therapies that treat particular pathophysiologies to have outcomes, right? And those are calculable relationships. The complexity is in trying to understand which sets of the calculable parts need to be evaluated. There's a great use of AI there, right? Because you can have a probability, then you can come to a situation where you've got a set of theories, which is what clinicians do, right? They come up with a list of potential conditions, and then come up with the most probable one and treat the most probable one, but keep a few of them in the background, like differential diagnosis. And then they use that as a therapy guide, right? So we can come up with a differential diagnosis, and then we can very predictably give you the right pathway given the characteristics of the diagnosis. And then we can do that evaluation. So that where we try and stick our use of AI is right in the middle there, right? The ability to figure out what you should do, be able to compute that quickly in terms of writing the code, the ability to give you an interface where you interact with it and have meaningful opportunities for predictive outcomes. And then in terms of interpretation of the outcomes of the deterministic components, creating the ability to report, evaluate, and make that feedback into the system so we can get better at the science and better participation. So it's a long answer to a question of how to use AI, but like how to use your brain, right? So that's how we're thinking about it.
It was a lovely answer as well, and I could listen to you talk all day, Duncan, but unfortunately we're coming towards the end. So my final question to you will be, could you give us advice on how you started your company that other people could learn from? Maybe some of the mistakes or some of the recommendations you would make to people who are starting out on their first time company.
Well, so the first thing you have to accept is if you can count your mistakes, you haven't made enough of them yet. And so I would say I can't enumerate my mistakes because there are so many and so plentiful that, I would say that the outcome of that is persistence, right? When you start a company, you are going to, it's like becoming a manager for the first time or anything else that you do. You're going to make a bunch of horrible errors that leave you in a situation where you question why you'd ever done what you were doing in the first place. So you have to, when you're starting a business, go into it knowing eyes wide open that it's going to be hard. Not hard in the sense that, you're bench pressing something that is breaking your muscles. Hard in the sense that it is going to take an emotional toll on you. It's going to take a physical toll on you. It's going to take structural toll on you. It's going to be financially hard. Everything about starting a business, unless you're incredibly lucky, in which case you won the lottery and don't worry about it. Everything about starting a business is going to be unexpectedly difficult. And if you're not ready for it, if you're not ready to give up all of the easy aspects of your life that you have today as an employee or as a person just starting out, if you're not willing to accept that you're going to have to work 7 days a week and that you're going to have to be the person on the hot seat when things go wrong that you have no control over, that you are going to be in a situation where other people's well-being is dependent on the decisions you're making. Like all of these pressures you have as a founder and as a CEO are going to show up. It's not, if they show up or could they show up, they are going to show up. And you have to be prepared for it. If you're not prepared for it, really reconsider whether you want to start a business. If you want to start a business, prepare for it. Be aware that you need to plan. You need to have a mechanism by which you can resolve the challenges you're going to encounter and have a framework in which you can get through that, with your sanity intact. That said, if you're going to start a business and you've got it in your heart, I was 18 the first time I did it, right? I mean, that business didn't survive because I was 18 when I started it. But the thing is, you do actually get a lot of joy out of it. You get a chance to have agency. You can interoperate with the world in a different way. You can build things that would otherwise be inaccessible to you. One of the things that you get the opportunity to do is, in the same ways when you own your own house and you can make decisions about how you're going to live your life inside that space. When you own your own business, you can figure out what it is that you want to do for society and for others around you or for yourself, whatever your model is, and be the driver of that agency. You're not dependent on someone else to let you know what's going on. You get control over that. So I think there's a huge value in starting your own business, and I'd encourage people who are motivated to do it, go in eyes wide open and be prepared for the crazy amount of work that's going to come your way.
That was fantastic advice. Thank you for sharing that with us today. It's been an absolute pleasure talking to you.
It's been a pleasure chatting with you too. Thanks, Brett.
That was Duncan Weatherston, CEO at Smile Digital Health.